Hello, ladies. For those who are watching, sorry about the little delay. There was some technical issues and we could not get into the room. So we decided to come on as a live onto the energy room share. So we're ready to go. There is some issues with my internet today, so I hope it just keeps working fine. So I will not waste time in getting our beautiful guest on. As you know, I've given the intro, but I'll just go through. She's a GP in training and she runs her own business in facial aesthetics. She bakes amazing cakes. She sings so well and she plays the piano beautifully. I've known her a long time, since she was very young. And I said to her in my intro, I'm gonna bring up the earliest memory of mine, where we were all sitting with her parents, we were all chatting, and there was this young girl, I think 16, 17, or maybe 18, sitting in a corner and reading her own book, and she didn't want to delve into what we were chatting about. And I was getting really intrigued. So I went up to her and I was like, what are you reading? And this is what she showed me. Marcus Aurelius Meditations. And I was like, oh my God, okay, what's this? I came home and she said, it's an amazing book. So I came home, I ordered it and I loved it. And this book was my intro to nonfiction. And once I started, I couldn't go back to fiction. So our guest today is the one who introduced me to it. So let's welcome Sidra. Hello, Sidra.
Thank you for that introduction. I loved it. And I do remember that.
Do you?
I now that you mention it, I do remember it now. And I still have that book. And now I remember that we used to talk about it, but for a very brief time, didn't we?
I know, it was you who introduced me to it. So,
and, I remember giving you some other recommendations as well.
Please do, by all means. By all means. Tell me, how was your day today? You were at work and you've kindly agreed to come on.
Yes, I've just come home not long ago and I've made my cup of tea, so I'm going to be having it at the same time.
I've got my
routine when I get home. Good, cheers.
Cheers, yes, I love your mug. So for those who are watching, please do comment. Then we know you're here. And if you have any questions as we go along, you can keep asking. So Sidra, I'll start with the boring stuff. But it might be interesting for a lot of people, not for you. What got you into medicine?
Well, we are a family of doctors. Like, doesn't need to be said. I'm not going to lie. When I was a teenager, when I was at school and, you know, the teachers are kind of forcing you to kind of make a decision about your future, I was like a lost lamb. I didn't know what I wanted. I thought, like, I'm good at science, but I'm also good at art and I'm good at drama and I like singing, I like music. So for me, it was either something really, really creative or something that's going to help me make a living, essentially. And then, I mean, a lot of people say they go into it because they want to help people and they want to, you know, they want to make a difference. And it's only when I started working that I realized that why I'm doing this. And now that I'm doing it, I absolutely love it. I love the social interaction. I love the interpersonal relationships. And that feeling that you're making a difference, it's such a good feeling. And it's not the kind of feeling that you get when you're just a medical student or when you're in school and you're just watching someone do something. When you're actually making a difference, it's such a nice feeling. So I would say that, like, you know, I was influenced by my parents. I'd watch them work so hard and make such, you know, a nice living for themselves. And I saw them coming home happy. Like, they were very satisfied with their lives. They have a good social life. So, you know, I want to be like my parents. I want to be coming home happy, you know, and satisfied that I'm doing a good job.
Are you satisfied and happy?
Yes, I'm so glad that I'm doing what I'm doing, and like, inshallah, I'm sure there's like so much more to come. So I'm just looking forward to it.
How's the you're in the psychiatry rotation in GP training, right?
Yeah, so I'm doing my GP training, and I'm doing psychiatry as part of the training. So I've been there for about a month now. It's really interesting. You see a lot of very, very interesting people and quite disturbed people, actually. I had a patient today who was like completely, like, without giving it too much away, she was completely psychotic, and it was just, it was really interesting.
So are you seeing them in the premise of a GP practice, or do you have to go to special wards?
Yeah, so I'm based in a community mental health center. So those patients are usually the ones that are on medication, and you need to like monitor them, see them every month, make sure they're getting on fine. But then one day a week, I go into the ward, which is like the really acutely sick people. So today I was in the ward. And yeah, these are the people that need to be watched basically 24/7. Uh, some of them can be like suicidal, some of them can be psychotic, hallucinating, that kind of thing. So it's very interesting, but I don't know if I could do it like for life. I think it's a bit too much strain on my own mental health.
So any interesting? You don't have to obviously give names; it's data protection. But any anecdote, something you'd like to tell us?
Well, today, this for example, this lady was. We were sitting in the doctor's room, and outside the doctor's room, outside the window, you can see their like communal outdoor area. This lady was in her gown. I'm pretty sure she wasn't wearing anything underneath the gown because you could see everything. She didn't have it tied up properly. She went to the tree. She was shaking the tree. She was talking to the tree. So it's like it's quite disturbing, but at the same time, it's so interesting, like what the mind can do when it's not working properly.
Exactly.
So
So
yeah,
that's true. The mind is capable of doing so much.
so much, and it's amazing how much control you can have on how your mind, how healthy your mind is. For example, like I mean, you of all people should know because you do the meditation, and that's something that clears your mind, and mindfulness. That's something that's really encouraged in psychiatry. Not
Oh,
just the
yeah.
medication side, but actually doing like psychological therapies and talking therapies, well-being, that kind of thing. So
Oh, that's interesting. So do you want to just tell us a bit about what non-medical modalities you guys use?
yes,
Just
so
in,
I
just
mean, for example, yesterday I was looking at a patient's notes, and you basically see what sort of treatment they're having on the ward day to day. So they just keep a log of what goes on every day. And one of the activities they have is baking therapy. And I was just like, I
wow,
love baking, and that's something that is very therapeutic. It
oh,
elevates your
wow,
mood. So that's just something, to occupy them. They've got like drawing, art, like music time. They've got TV, they've got pool tables. So it's just trying to encourage them to interact with each other and do things that make them happy. So that was
wow.
quite interesting. Yeah.
It's really interesting because my idea of a psychiatric ward was hands tied, cuffed to the bed. I mean, I'm making it over dramatic, but I wouldn't have thought that they're introducing these kind of things, creative
I
abilities
mean,
for them.
a lot of people say that mental health in this country is not treated properly, but I think it's treated excessively. Like, they really take care of the mental health patients. There's so many services available, and there's always someone to speak to, and you can even go through your GP. Like, if you feel like you need some sort of help, the GP can direct you. Like, for example, if you've suffered from a bereavement, there's services for that. And
That's good to know.
I think a lot of people think that they have to deal with things on their own, and no one is there to help them, and they don't want to share it with their family or friends because they don't want to be a burden. But there are services out there that specifically deal with that kind of thing. So
That's
I don't know.
interesting
It's
to
just my
know.
opinion. I think I would encourage people to go through that if they need to.
That's it will be a good GP. I can see one in the making.
I hope so.
Because again, yes, it's true. My understanding again was that if you've got bereavement or if you've got certain other issues, you've got to deal with them at home. Why would a GP be interested in that kind of issue? But that's good to know. that you deal with it. I think there is a little lag in our conversations. I'll just tell you, Sahar Imran is saying Sidra is an all-rounder. Indeed, she is. Yasmin Khan is watching as well. And Aisha Naveed is saying hello from Chicago. Hello back, Aisha. Thanks for watching. Right. So tell us why aesthetics and what made you start up your own business. Talk to us about your facial aesthetics business.
Okay, so for those that don't know, facial aesthetics is essentially a branch of medicine, you can say, that deals with essentially making people look better, more rejuvenated, more youthful, just to sum it up in simple terms. So the reason I got into it, actually, I was in my junior years of medicine, and one of my very good friends told me about this course that she was doing. And she said, "Oh, you know, aesthetics, you would be really good at it. You know, you like to take care of yourself. We talk about, beauty and makeup and things like that. So you would be perfect for that." And I'd not even thought about doing anything like that. I just thought, medicine, just follow one track and, finish, go to the end, and, that will be it. But then I thought, you know what? When you have a medical degree, you can do quite a lot with it. And I think, dentists also delve into aesthetics as well. It's definitely a branch that's available to them. So yeah, I started doing it, and I did a few workshops, a few like mentoring sessions, and I just thought that this is for me. Seeing patients and just improving their appearance with such a small treatment that makes such a difference to their confidence and to their happiness. It's just something really fulfilling, and I think it's such a great thing to get into. I would say though, it's not for everybody. The clients are usually women. They're usually like, very conscious about how they look sometimes. So in that respect, it can be quite annoying for some people. But I'm someone that likes to see someone happy about their appearance. So I don't know. I enjoy it.
And why not? When you said to me, I think it was about a week or more ago, and you said when you provide the facial aesthetics, Botox or dermal fillers, it's the confidence and the life. It can be life-changing as well for some women, which got me, because as you rightly said, dentists can do that as well, and I've done the course in it, and I've performed aesthetics myself. But yes, if you look at it that way, because all we see in the media, and in fact, I was on a webinar yesterday, and that's what they were touching on, that all you see in the media is the case has gone wrong. Whereas when you actually take away somebody's unwanted lines, or if you give them a confidence with a, that's a huge thing. I hope, Sidra, you can hear me, because I think we lost you in the middle for a bit. And Aisha is saying, "You're welcome. I'm in the train on my way home after work. This is my first time." Oh, thank you, Aisha, for logging in and watching. If you have any questions, guys, please, you can ask Sidra. So any message you'd say regarding aesthetics in particular, I would say, for women? There's so many on here. I'm sure they'd want to know.
So do you mean people that want to do aesthetics, or people that want to have treatments?
Either ways, because it can be used as a treatment modality as well, isn't it? Botox, especially.
Yes. So I feel like, obviously, you shouldn't be afraid to get older, especially as a woman, because we do age and we do develop lines and wrinkles that weren't there before, sagging, that kind of thing. It is beautiful. Like, you are beautiful as you are, but there is a beauty in maintaining youthful appearances, and that's something that is universal. If you look on TV, if you look at these actresses, people on the red carpet, and you say, "Oh, she looks really good for her age," or "She looks really fresh and rejuvenated," most of the time it's not the natural progression in their facial appearance. They've definitely had something done. But as you
Sure.
said quite rightly, normally they report on the not so successful treatments. So the ones that look bad, that's the ones that get the most attention. But the ones that don't get the most attention, that means that you've done a good job, actually. So very subtle but rejuvenating treatments to make you look fresh and youthful. That's what I believe in. So it's not for everybody. Some people are completely against it, which I understand, but
Yeah.
I'm not against it, and I'm happy to make someone feel good about themselves.
Absolutely. Would you like to mention the name of your business, and if somebody wanted to get in touch with you, how do they do that?
Yes, so I have an Instagram page actually. It's London Lux Aesthetics, just one word. So at London Lux Aesthetics, and you can get through to me on WhatsApp if you want to. I've got my details on there. So.
Okay, great.
Obviously, during lockdown, it's not been very very busy. So
Yeah, hopefully lockdown will be over soon for us in UK and worldwide, and then we can resume back to some normalcy. Sidra, I will ask you a question from my interest, going back to your GP training. So I've had, and it just so happened in the last 1 week, I had 3 young patients come to me. Young girls, one was 19, one was 21, and one was 24. And they were all on fluoxetine. For those who don't know, I'll let you explain what fluoxetine is. Mm-hmm. And obviously, as a dentist, I'm not in a position to say why they're doing it. One, I asked and she said it's for my mood stabilization. But for me, it was quite a shocker. And one of them, who was 21, has been on antidepressants for 4 years, or mood stabilizers for 4 years. What would you say to that?
What I would say is that if it's a young person that thinks they're depressed or they think they have some sort of mental health issue, there's usually a root cause, and usually that cause can be identified through therapy, from what I've seen. And usually it's something that's happened in the childhood that manifests in later in life, as depression, as anxiety, that kind of thing. So I feel like in the UK especially, it's quite easy for GPs to hand out antidepressant suites. For me personally, I feel like it's not a ticket to feeling happy. It's not just a long-term solution, because at the end of the day, you're relying on a medication to make you feel better. And I'm not saying it doesn't work for everyone, because it certainly works for a lot of people, but a lot of the time they just want a quick fix, which I don't personally believe in. So I would personally recommend seeking therapy or well-being services in the first instant before starting medication. But I don't want to give any medical advice on here, but that's just my opinion.
No, but coming from you, medically trained, who's training in her GP training, that's a huge thing for so many ladies on the group here, for them to know that a medication is not the only resort. There are so many other methods that can be employed, that can be done. And I'll come out. I've come out before as well, but I'll own it that for twice I was given antidepressants by my GP, and they did not work. The longest I took it was about 9 months.
Yeah.
It didn't do anything, nothing at all. And in the end, I just dropped it. And what worked for me personally was coaching. Some other therapy may work for someone else, but there are other therapies out there. So not everybody wants to come out, which is fine. But if anyone is listening and they think they're on antidepressants and that is the only way, it may not be the only way. That's coming from a medical doctor. Am I correct?
Yeah. All right. And it's funny that you mentioned at the beginning of this chat about that book that I recommended, because there are a lot of books out there, not necessarily therapy books, but like philosophy. And science and just informative books, you know, just increasing your knowledge about the human condition is enough knowledge to make you feel better. Like, I don't know, like everyone feels the same emotions but to different extents. Like, you're not alone, and you know the problem is not usually with you. It's to do with, it's just to do with life, really. Everyone's got issues. Everyone's got things that they have to work on with themselves, and just understanding that it's a universal problem is a huge step. And being able to identify that there is a problem in the first place, that's a huge step, because a lot of people that don't even know that there's a problem in the first place.
Exactly. So true. So true. Tell us about your baking as well. How did that start? Did it come about due to COVID, or was it something you've always enjoyed?
Yeah, so me and my friend, we basically, when it was the lockdown, we were living together, and we just started baking one day, just because, you know, our boredom, really. We weren't going to the gym, there wasn't anywhere to go, we couldn't go out to eat. So we thought, why don't we just try some new recipes at home? And then one led to another, another, and another. So we were baking almost every day. But it was almost like a challenge. Like, what can we make next that's going to be even nicer? So
made some amazing cakes. I've had them. They are just really gorgeous. Can we touch
so my
on...
friend is more into like the baking.
Okay.
So my friend is more into the baking aspect, and I'm more into the decorating aspect. So together we made quite a good team.
That's quite a good team. Can we touch on some other topic, or do you want to say something? I don't want to get in trouble.
I know where this is going.
Okay, we'll touch very briefly.
I think I know what you're going to ask.
We'll touch briefly on it, because a lot of people, no matter what age group, I think they are in the situation, and we'll just keep it very light and funny about dating and dating apps. And I would say especially dating apps in UK or the West. And if you're trying to look for our skin color on the typical apps, do you want to talk a bit about it? Oh, there is a lag.
Okay. I'm really embarrassed because I think Mom is watching this.
I haven't seen her name, though. Honestly, I haven't seen her name, but up to you if you don't want to talk about it.
To be quite honest, she already knows all the horror stories, so it's not like it's nothing she hasn't heard before.
Yeah. Okay, I'll tell my recent incident, as I call it. So this guy, and there's no name shame. This guy, because he's from, his name sound as if he was from Pakistan. So we spoke last week, and it was fine. But then he started trashing Pakistan and things about Pakistan. So obviously that didn't go down too well with me. And I just said, okay, there's somebody at the door, I've got to go. And that was my way out of it. Because I just thought, I mean, you've got that origin from there. And I've told you that I am from Pakistan, and I was speaking quite fondly about it. But that's what he said, and it kind of put me off. So I don't know if you want to add something of the some funny incident or...
What I would say is, if you are on these dating apps, make sure that you know who you are going to hang out with, because once I ended up hanging out with someone who worked in Chicken Cottage. Now, I don't have anything against people that work in Chicken Cottage, but you can imagine that the conversation was probably a bit different and not, to my level.
Right. So, okay. So had he declared to be someone else? Because I have had that experience where they declared to be something else, and when you start talking to them, it's a completely different age-wise,
Oh gosh.
profession-wise.
To be honest, I will take the blame for that one because I didn't ask him. And that was my fault completely. But I was a bit upset that I'm gonna sound so stuck up, but so we were walking down the street and we walked past Nando's, okay? And he said, "Oh, I really like Nando's." And I said, "Oh, we can go there if you want," because we were trying to find somewhere to eat. And then he said, "Okay, let's go to Nando's." And I was like, "Oh, I don't really like Nando's that much. I was just trying to be polite." And then apparently in Nando's you have to pay at the beginning, okay? So we ordered what we wanted to eat, and then he was about to pay, and then I said, "Oh, I can get it." And then he said, "Okay." So I ended up paying for both of us.
Oh, okay. Yeah. That's happened a lot.
No, but
Ladies,
to be
yes.
honest, like it's not that I expect someone to pay for me. That's not how it is. But I just think like I shouldn't have to pay.
I know there's that feminine side kicks in where you want someone else to.
Yeah, exactly.
Okay, Anushka. Hello, Anushka, and she's got a different take on it. She's saying it's not at all, and it's not all bad. I've had a couple of Desi friends who found their life partners on it. Anushka, please do me a favor. Find out the app from your friends and just inbox me the name. We'll try as well. In the UK, okay, that's great news. And Sadia Khalid is here as well. Hi, Sadia. Okay, so we're coming towards the end, and we're not going to let you off without listening to sing. And up to you if you want to play the piano or you just want to sing.
I can. You know what? Because I know this song already, and I did practice it a little bit because you asked me to do it, so I can do it on the piano because I have my piano here.
Ooh,
I just have to. I'll just have to move this.
Nice chair.
I don't know if you can you see me?
You can turn the camera around. Is that what you're trying to do?
That's all right, isn't it?
Yeah, that's fine.
Okay?
Yeah, you can see your books and your lovely piano, keyboards.
Is the sound okay? Is it cutting off?
No, it's fine. When you start talking, it's fine. It's been fine.
Okay, here we go.
Yeah.
I'm gonna start again because. Okay, I'm gonna start again. Sorry. Okay. They say, "Oh my God, I see the way you shine." Take your hand, my dear, and place them both in mine. You know you stopped me dead as I was passing by. Now I beg to see you dance just one more time. Ooh, I see you, see you, see you every time. Oh my, I like your style. You make me wanna cry. Now I beg to see you dance just one more time. So they say, dance for me, dance for me, dance for me, oh, oh, oh. Never seen anybody do the things you do before. They say, move for me, move for me, move for me, yeah. When you're done, I'll make you do it all again. I said, oh my God, I see you walking by. Take your hand, my dear, and look me in my eye. Just like a monkey, I've been dancing my whole life. You just beg to see me dance just one more time. Ooh, I see you, see you, see you every time. Oh my, I like your style. You make me wanna cry. Now I beg to see you dance just one more time. So they say, dance for me, dance for me, dance for me, oh. Never seen anybody do the things you do before. They say, move for me, move for me, move for me, yeah. When you're done, I'll make you do it all again. They say, dance for me, dance for me, dance for me, oh. I've never seen anybody do the things you do before. They say, move for me, move for me, move for me, yeah. When you're done, I'll make you do it all again. All again.
Ooh, wonderful. God, I love your voice.
Thank you.
Beautiful, beautiful. Unfortunately, the piano sound wasn't coming correctly, but I didn't want to stop you. But I'm sure maybe afterwards the recording might be better. If it's not, then if you've got a recorded version of this, please do post it on the Energy Room Share, just the recorded version of your song. I'm sure everyone will know it. Anushka and Yasmin and Aisha all are saying thanks. It was beautiful. Thank you, Sidra. After a full day's worth of work and at the end of the week, giving us the time. Thank you so much.
Thank you for inviting me. It was lovely to chat.
It was indeed. You take care. Have a lovely weekend. And thank you, everyone who watched and commented. Bye.
Say bye.